Hi, my name is Brian Dong, and I'm a breast oncologist with U of L Health. So my journey into medicine is a pretty typical start. Both my parents are physicians, but I was kind of atypical in that when I went to college, I kind of was trying to look at everything else. I took economics, philosophy, all sorts of stuff just to see is there anything else that would stand out. I did some volunteering at the local hospital, and I just got randomly assigned to help out with the oncology floor, a couple times a month at the start. And the first time I went, it was Arts and Crafts Day. So I ended up spending a few hours with some patients and their families. I realized there's only so much I could do as a volunteer, and I realized the people offering them the most was their physician. And that's kind of how that all started. So I'm a breast oncologist at U of L, and what that means is I'll see people who have been diagnosed with breast cancer, are at high risk for breast cancer, or have questions about what's their surveillance going forward to reduce their risk as much as they can. We see people at various stages in their fight against cancer, and we have different resources at each part of the journey to help them out, whether it's before surgery, after surgery, or trying to prevent cancer from coming back. A big advantage of coming to U of L is that the oncologists like myself are able to kind of specialize into one disease state. So the vast majority of what I see is breast cancer. We're part of an amazing team here at U of L, from our pharmacists to our nurse clinicians to our nurse practitioners. The whole team is there to help out people specifically with breast cancer. And that's on any visit. We address things from the actual cancer to mental health to sexual health or reproductive health. We have comprehensive care given at every visit. In today's time, for a patient to have that kind of diagnosis and have to choose a cancer center that they trust, it's something that's very important to them and their family. And that's something that I'm very cognizant of, that someone's putting the trust in me and my team to give them the best care possible. So that means when we see them, we address all their complaints that they know of, that they're telling us, and maybe that they don't know of, that we have to be mindful of as their medical team, to give them the best chance in their fight against this thing. So I was originally raised in Kentucky, in Louisville, as a kid. I went to Norton Elementary, if there are any other alumni watching that. And then I've been back for 10 years now for my training, and I gotta tell you, I absolutely love Louisville. I love the state of Kentucky. I love the food scene here. I do a lot of cooking and eating on the side as well. I like making my own pasta. I make, probably one of the better homemade dumplings you're gonna have around town. And, I have a couple of dogs, so I love kind of just exploring the parks in the area and just kind of being outside and doing things like that.